People often have no idea how expensive it is to get sick, to have to go to an emergency room visit. It can be financially devastating. It makes very little sense in this modern day and age to go without some kind of health insurance.
But many local families are contemplating doing just that as the reality of rising ACA healthcare costs hit home in the new year. Good evening and thanks for joining us. I'm Jackie Jovic.
And I'm Dan Jovic. People in the Arklatex are among the hardest hit in the nation by the rising costs as many families decide if they can take on the added monthly expense. State of Arkansas is projected to have the single largest percentage jump on an average ACA benchmark premium in the entire country. Last year, ACA benchmark coverage costs roughly $458 a month. In 2026, that number is $774 a month, a 69% increase.
In Texas, people can expect around a 35% increase in premium costs, jumping from $489 a month to around $661. That's the sixth highest jump in the country. In Louisiana, the increase is a little over 23%, with the benchmark costing around $646 a month. NBC6's Maya Alicia spoke to an expert on the topic and joins us live in studio, sharing more in tonight's top story. Maya?
Dan and Jackie, the Kaiser Family Foundation says health insurance premiums have spiked for thousands of Louisiana families. They estimate 70,000 people will drop their coverage because they simply can't pay the increased cost. The deadline is quickly approaching for Arklatex residents to purchase private health care insurance through the ACA marketplace. KFF, an independent source for health policy research, says rates will be going up for virtually everyone in the new year.
Some people may decide that they need to leave the flexibility that comes with gig work or their small business, as we know that about half of people on the marketplace work for a small business or are self-employed and part of the gig economy.
Enhanced federal tax credits that helped make coverage affordable have now expired and healthcare costs are rising. McGough says some people may not even realize what is happening because they are auto-enrolled year after year if their information hasn't changed. He says the jump in cost will not stop people's medical needs,
which means that doctors could be seeing more people who can't pay their medical bills, and this has to go under uncompensated care, or a lot of people who may need medical care might not seek it just because they don't have any health insurance coverage.
Not purchasing coverage doesn't mean losing all options. Community health centers, healthcare navigators, and programs like Medicaid may still be available to you. The Kaiser Family Foundation is calling it the largest rollback in health insurance coverage in modern American history. Maya Alicia, NBC6 News. Dan and Jackie, back to you.